All right, we're recording. Hi, I'm Tyra Butler, licensed marriage and family therapist, and I'm here with Heather Seguin. Am I pronouncing your last name right?
Close enough.
How do you pronounce it?
Seguin.
Seguin. Okay. And she has an office in Upland. She used to have a practice in Glendora and has moved to Upland for her specialty in sex and porn addiction, right? Works specifically with couples. Okay. And she has a presentation that we're all very excited about that she's going to be doing next Friday, November 16th from 9 to 11. It's called It's All a Lie, Helping Couples Heal from Sexual Addiction and Betrayal Trauma. And it's going to take place, this is with IE-CAMFT at the Loma Linda University Department of Social Work and Social Ecology. So don't miss out. If you are a member, it's free for you. This is part of your membership. If you're not a member, it's only $10 to come and learn all these valuable tips and her wealth of knowledge and expertise on the topic. So today we're going to chat just a little bit about her practice, her specialty, what led her to get into this specialty, and hear just a little bit about what the presentation is going to be about. So, hi, Heather.
Hello.
Okay, so I sent you some questions, and I personally was really curious if we could maybe talk about how you got into this line of work, into therapy, into specializing in working with couples.
Well, gosh, if we go into why I'm a therapist, that one starts off probably in childhood. That one starts off as, helping friends get along better on the bus ride home from school. It started way back when. But in terms of specializing in sex addiction, that started in, kind of initially started, I'd say, in like 2012, 2013. Really my interest in working with sexual issues is really, and why I do this work in particular, really is not about sex, but about shame. I just encountered so many clients who had a ton of shame, like really, really crippling and unnecessary shame around sexual issues that they just didn't have anyone to talk about it with. And some of it was just like really poor education. And I had clients who had really like either traumatic or just confusing sexual experiences in childhood, and then carried shame about that, and hadn't really ever processed it or talked to anybody about it. And so I wanted to be a person who showed up for them. It was almost like a justice issue for me that people have a place where they could talk about something that was so shameful for them. So that interest led me to my last MFT supervisor. I worked with a man named Dan Drake in Studio City. He now has a group practice called Banyan Therapy Group. And I was specifically referred to him as an intern because of my interest in sexual issues. And so he specializes in sex addiction, and, asked me to read the book Out of the Shadows by Patrick Carnes. And as I read through that book, I just cried my way through it. Because reading the stories of people who not only do they struggle with shame around their sexual behaviors, but they also have a lot of trauma and a lot of just unprocessed relationship stuff. I wanted to be able to support that community of people. So that's what got me started working with Dan, and I did my CSAT training. So I'm a certified sex addiction therapist through ITAP, the International Institute of Trauma and Addiction Professionals. And then I'm also a certified clinical partner specialist candidate with APSATS, which is the, I always get it wrong because it's a long one, but it's that's where the partner trauma model comes from. Looking at the experience of a partner of a sex addict from a trauma lens rather than a codependency lens. The old school mindset around sex addiction is that a partner was, just as sick as her spouse, her typical pronoun, right? Not normal, but The common pronouns are that he is an addict and she is the partner. But this absolutely impacts women who are sex addicts and have male partners. It impacts, same-sex couples, married, not married, every socioeconomic status, every race, every age group. I've had clients as young as like 15, and I've had clients as old as 74. So it impacts everybody. So why I got into it is I wanted to just be able to serve that population really well with something that can be such a sensitive topic.
Yeah, it's such a sensitive topic.
Really, since I started specializing in sex addiction in 2013, so 5 years. And I work with all parts of the process, I guess. So I work with individual addicts and individual partners, as well as couples who have experienced some type of, sex or love addiction. And I really enjoy all of it. I have colleagues who prefer certain parts of the dynamic, but I really like all of it. And there have been like interesting ebbs and flows in my practice where there have been times where I work with predominantly addicts and maybe 1 or 2 partners. And then there are times where it totally flips. So it just depends, but I work with all pieces of the puzzle.
Okay. Fascinating. And it's such important work because a lot of the couples, that do come into our offices, I think whether they present or say it at the outset that, oh, we're coming in for an addiction problem or what have you, they usually, often don't even use that kind of language. Comes out in session. And so it's really important to be able to have people that we can refer to confidently. That's one of the reasons why I started the Facebook group, IE Shrinks, is to be able to have people to refer to, confidently and know what each person does. Okay, so are there any stories that you feel comfortable talking about, or experiences that you've had that, not personally, but
Sure. Well, that is a common
to talk about.
Yeah, that is a common question. People it goes back to, why do you do this work? And oftentimes we do the work that we do because it's coming out of our own life story. And for me, that's not the case. I'm not a sex addict. I'm not the partner of a sex addict. But it really goes down to that shame and wanting to help people with that shame. So it's a common question that people ask me. In terms of stories, there's so many. I think that maybe one that I'll share for right now, which I'm probably not going to cover on next Friday, so I'll share it a little bit here. So I had a client who was in his mid-20s, who worked in the technology field, who, I think his primary reason initially for coming in was grieving the loss of his last relationship. He'd been in a 2-year relationship and it had just really crumbled, and he was very heartbroken and just wanted to process through that. And he mentioned that, porn was a little bit of a problem. And the more that we worked together, we realized that it was a true addiction. And not only was it, compulsive sexual behavior, but it also involved child pornography. And so, which is, I think, more common than we realize. And carries, for him in particular, carried an extra measure of shame.
I can imagine.
Because he knew that it was wrong. He had just a lot of fear around it. And the reason that I think his story is so important is that, and this is where I might push some buttons because it can be a triggering topic. Because it's an illegal activity. It's an exploitation. It's sexual abuse. And there's an automatic assumption in our culture that people who look at child pornography are monsters and creepy and evil and all kinds of really, really bad adjectives. And I'm not saying that some of that isn't true sometimes. Like there are definitely people who are predators. And then there's people who, like my client, who really suffered with it. He hated what he was doing and yet couldn't stop. And I mean, he even considered like chemical castration, and he would go to great lengths to avoid being around children at all costs. So it was a very, very painful thing for him. And, you know, we did a lot of work around it, in terms of, you know, a lot of our work was kind of more on the harm reduction side of, okay, maybe, you know, we don't eliminate your pornography addiction altogether, but let's get it into the legal sphere. So, but what I want people to know about that is that, you know, this was a young man who isn't gross or creepy or not a predator, like truly would go to any length to avoid harming a child in person ever. And just was really riddled with a lot of shame. So for me, it was easy to work with him because I saw the root. The root was a ton of shame and a lot of self-hatred. There was never any intent on his part to harm anyone. And I want people to understand that, like, that's really what's at the root of sex addiction is a lot of shame, a lot of fear, a lot of self-hatred and loneliness. And, you know, when we understand that, I think it helps us to have a little bit more compassion for where people are coming from. Because we all have judgments, first of all, you know, as open-minded as we like to think that we are, you know, to a degree, we can't help but have judgments. And I think that when we get to know people's stories, it helps us to have a broader perspective for interpreting even our own judgments. So this client I worked with for several years. I think I worked with him for 3 years. He was my very first client when I started in that practice, and I worked with him up until I left for maternity leave. So it was over 3 years working with him, and he made a lot of progress moving forward. He was able to grieve the relationship that he lost. He was able to, you know, pull back on some of his illegal behavior and even get some sobriety from other compulsive behaviors. And was able to start a new relationship and, you know, grow in a lot of ways. He still had some work to do. He had a lot of trauma that was very much unprocessed, a lot of childhood neglect that he didn't even notice. He didn't realize was neglect. He didn't realize that it was trauma. It was. So there was a lot of work for him to do there. So that's one story. When it comes to couples, I think I have a couple that I've been seeing for, about 18 months now. And they've been married for about 2 decades and have been through a lot together. Multiple addictions, methamphetamine, alcohol, sex addiction. And, you know, he has been the addict, she has been the partner. So there's been a lot of multiple addictions on his side, and then codependency, eating disorders on her side. And it's been a very painful journey for them for a long time, because they've been through multiple addictions, multiple stints of different types of treatment. They moved out of state and then moved back for various things. There's been like legal action due to not even due to sexual behavior, but due to embezzlement because of drug addiction. So they've been through a really hard road.
Complicated case, yeah.
Yeah, and so working with them together, I've worked with them both together as a couple, and then I've seen both of them individually too, which I know not everybody does. Usually I prefer to refer out, but in their case, it worked best for me to see them as pieces of the puzzle and together. And what's really rewarding about working with couples who are coming through addiction and, you know, journeying through recovery, is, you know, couples who are doing recovery work are really fun to work with. And I think the biggest reason is that they have, you know, 12-step work gives people a framework for, and a bit of like just a structure for healthy relationships. First of all, a healthy relationship with self, right? Like when clients do their step 4 and they're really forced to confront how they got to be where they are, and like the things that they struggle with and the missteps that they tend to make. When people do that as a step 4, And they, you know, when they get to step 10 and they're doing a regular inventory to make sure that they're kind of staying on top of things and they're not letting resentments get in the way. They're fun to work with because they're really motivated. They're motivated and they have a basic understanding of how to pursue a healthy lifestyle and the importance of a discipline in their life. And they're willing to look at their own stuff and be honest about their own stuff.
That so, yes, it's huge. And the desire.
Yeah. So working with couples in recovery is really fun for me. I mean, not all couples, you know, there are some couples that don't make it, where for whatever reason, they're either just not able to get past the hurt, or one person is not willing to change. But the reality is that the majority of couples actually do stay together. And so that's also fun because you get to see like redemption, you know, come through, and you get to see hope come through, and you're able to watch them implement new skills and tools. So it's really fun.
Yeah, it's so amazing to be a part of a couple healing and reconciling and wrestling through their turmoil, their struggles. Yeah. So you mentioned 12-step work. Are there other skills or approaches that you use, whether it's practical or theoretically oriented, that you use that you found very helpful?
I use whatever I have at my disposal. So 12-step is really helpful because for people who are coming out of addiction, because oftentimes, you know, any addiction is an out of control behavior, right? And so 12-step work gives people a structure, right? It's like, do this, then do this, and you move, you know, in sequence, and it has a rationale behind it. And people who are, you know, used to chaos really need that kind of structure. So that's helpful. As a CSAT, we have what we call a 30 task, 30, that's 30, a 30 task model. And it fits in really well with the 12 steps. I'm not rigid in holding to the 30 tasks, but it kind of gets incorporated in a more flowy way for me. So 12-step can be either, you know, an SA or SAA meeting. There's also some faith-based 12-step groups like Celebrate Recovery, or Pure Desire groups, things like that. And those to me are great supports for a client who is in recovery. It is not a substitute for therapy by any means, but it's more about having a place where you know you're not alone, and to get yourself out of isolation. Most people who are addicts, particularly sex addicts really struggle with intimacy. And so there's a lot of social isolation. So getting them integrated with a community is a really important part of their recovery. And then of course, so other tools. I'm also a Gottman trained therapist. So I've done, you know, Gottman 1 through 3. So the last step for me is just completing the certification. So it's on the list.
Awesome. Yeah.
One of my goals for the next year is to, I started doing training to be a sex therapist through ASECT. And so I don't advertise it as a current specialty because I haven't done enough training to feel competent in that area. But it's something that I'd like to work towards, just so that I can make sure that I'm treating all sides of sexual health, not just sexual addiction. And there's some controversy around that. And I want to be someone who can bridge the sex therapy world with the sex addiction world.
Awesome. Very important work. So how would you describe or define what sex or even porn addiction is? Like, how do we know that it's an actual addiction versus something that just someone does?
That's probably one of the biggest questions, and part of why it's a controversial word. The word addiction really it's a combative word for a lot of people. Some people prefer to call it out of control sexual behavior or sexual compulsivity because they don't like the term addiction. I always tell people, look, call it addiction, call it a purple elephant, I don't care. You know, the bottom line is this causing problems in your life? Let's deal with that, right?
Yeah.
Now, some people really benefit from calling it an addiction, and that really helps them to like keep their head straight about it. And for some people, it causes a lot of shame that totally shuts them down. So I'm like, hey, let's not let semantics get in the way of treatment.
Yeah, the label is important. I'm just going to turn on my light real quick here because it's getting dark quick.
Yeah. Better.
Okay. Sorry about that.
No worries.
Okay.
Our daylight savings schedule has shifted.
Yeah, definitely.
So when it comes to understanding the difference between sex and porn, or even love addiction, and just problematic behavior, there are certain criteria that I use in my assessment. We're going to talk some about that when we meet that Friday, right? So I'll just share a little bit about that right now. So I use an acronym called PATHOS as just a really quick way of assessing if something might be an addiction. So you're looking for preoccupation, right? That's the P. If someone kind of has sex kind of running around in the back of their mind on a regular basis, not just the like sporadic sexual thought or like, oh, that person's attractive, but this is like almost like this subtle obsession that's kind of going around in the background all the time. The A is ashamed. And when I ask people about it, I like to sometimes look for the feeling of shame, but also I'll ask, do you hide your sexual behaviors? Because sometimes people might not feel shame, but they might hide their behavior. And oftentimes when we're hiding, it's because we feel shame. That's not always the case. Sometimes people hide their behaviors not because they feel shame about it, but because they know how other people will look at it. And so we have to kind of discern, is it shame for them, or is it just that they just don't want to deal with other people and what they have to say? Or that they're just private about their sex life, right? Because that doesn't make you an addict. The T is, have you sought treatment? And so that could be specifically for a sexual issue. Or I like to think of it as, especially with couples, have you gone to couples counseling and maybe sexuality didn't really come up, but that was definitely an underlying factor in the marital conflict. So I like to ask it that way too. H is, does your behavior hurt others? And, the obvious one would be in a committed monogamous relationship. Oftentimes that's where the most obvious hurt happens. But I also like to encourage people to think about it from an employer perspective. If you're somebody who's watching porn for 30 to 60 minutes a day at your office, that's time that you're being paid for that your employer is not getting a return on their investment. And so that is hurtful to the company. So I like to have people think about, there's lots of ways that your behavior can hurt others that might not be just sexually. Obviously, another one is, if you are having sex outside of your relationship, you might also, you're opening yourself up to an STI, which is another way that your behavior can hurt somebody else. So just those kinds of things to take into consideration.
That's very handy, yeah.
Say that again?
No, that's very handy. The acronym and the way you're breaking that down. Yeah, makes it easy to remember.
Yeah.
Go ahead. I didn't want to interrupt you.
So O is for out of control. So that's the typical, thing that we would ask for any addiction, right? Alcoholism too, right? Like, have you tried to stop drinking and you just really can't? It's like, well, have you tried to stop looking at porn and you can't? Or have you tried to not go to a massage parlor or see a prostitute, but you just can't? Those are the things that we're kind of assessing. Does this control you or do you control it? Who's in charge here? And then the S is, are you sad? Do you have a sense of despair or like grief when you have finished your acting out behavior, right?
Oh yeah, that's very important.
Yeah, so because of course,
or guilt.
Right, exactly. Because a lot of times people will say, okay, that's it. I'm never going to do this again. Like, that's it. That's my last time. And then, within a week, they're right back where they said they weren't ever going to be again. And so that's the out of control part. And then what comes with that is the shame and the sense of despair, like I'm never going to change. I can't help myself, and like I'm a mess, and there's a lot of feelings of worthlessness with sex addiction. So as I look at those 6 things, if someone is hitting 2 or 3 of those, they're probably a sex addict. They might not be, but they probably are. And so that's where I start. I actually have the Pathos acronym. I don't use it as an acronym, but I have the questions as part of my intake. So every single client that I see answers those questions. Sometimes it's interesting, I'll have partners of sex addicts who will endorse preoccupation with sex. And so when I see that, I'm like, well, yeah, of course, because, her head is swirling with, what did my partner do with whom and when, and how did I not know? And so that's the partner side of things, is that oftentimes they have a lot of like intrusive thoughts around sexuality, and it's all rooted in trauma. So, and I'll probably talk a little bit more about this on Friday, but if someone is hitting a couple of those criteria, the next step that I have them do is you can go online, and for free, you can take the sex addiction screening test. You can just Google it, sex addiction screening test. Last time I checked, I think it was 52 or 53 questions. And I think they're all like yes or no. And, when you're done, it'll give you a score. And, it's on a scale of 1 to 20. Maybe 0 to 20. I think it's 1 to 20. And, if you're scoring above a 6, you're a sex addict. If you're scoring in the teens, like in the teens and up to 20, like 16 plus, it's having a pretty significant impact on your life and relationships. Oftentimes we see numbers in that range on the more inpatient treatment side. So there are inpatient treatment programs. Much the same way as you have inpatient treatment for alcohol or substance addiction, there are also inpatient treatment programs for sex addiction. And so when someone is scoring 15, 16 plus, they're having enough of an interference in their life that they might benefit from an inpatient treatment. So that's what an addict looks like, right? There's also a ton of people who engage in sexual behaviors that aren't helpful, who are not addicts. And I have had people come into my office who say that they're sex addicts, and I'll do my assessment with them, and I'll tell them, you're not. You're just not. You don't meet the criteria. And even though I'm a sex addiction therapist, if you don't meet criteria, you don't meet criteria, However, we can say, okay, well, you're not an addict, but this is causing you problems in your life, right? So let's look at that, right? Like, you might come in because you drink a lot, and, you're not really an alcoholic. You don't meet the criteria. It's not enough of an interference in your life that you're an alcoholic, but maybe you're a total jerk when you drink. And so your friends are ticked off at you, and you're ruining your relationship because you're just a jerk. You're fine when you're not drinking, but maybe you're just a jerk when you're drunk. Like, we should still work on that. We should still figure out, how do we change your relationship with drinking so that you can keep your relationships healthy. Right? So that's the biggest issue that I see with this is around pornography. So, if someone has stepped into the field of paying for sex, whether that's strip clubs or massage parlors or prostitution or whatever, if someone's paying for sex, from my experience, they're more likely to be a sex addict, just because of the impact of sexual exposure to STIs, as well as financial burden. Usually if someone's in that territory, they're probably on the addict side. If someone is, but not always.
Right, it could be recreational, right?
What's that?
It could be recreational, or they could consider something like that in that gray area. Right.
But when it comes to pornography, oftentimes pornography couples do find destructive to a relationship. I had clients where, I had a couple come in just a few months ago, and, the idea is that, he was a sex addict, and I did my assessment. I'm like, well, you're just not. You don't meet the criteria. However, her discovery of his use of pornography was extremely destructive to their marriage. It broke a lot of trust. It caused a lot of hurt and pain and questionings and like reevaluations of their life together. It was very devastating for them.
Mm-hmm.
And it was just porn.
Right. Yeah. I've worked with couples with similar, situation where the person who, who finds out about the porn, that feels like they've been cheated on as if it was, they were having an affair with a person. It's just as
Right.
devastating. Yeah.
Right.
Mm-hmm.
And so I think what's most important for the people coming to this training, like that's the kind of population that I want to speak to, because again, not everybody coming in with some kind of sexual betrayal has a sex addiction. So, when you're dealing with a true addiction, please send them to a specialist. Send them to someone who really understands what sex addiction is and how to treat it, because there is a specific process with sex addiction. And I do consultations with colleagues all the time where they'll ask me questions about, like, okay, here's the client that I'm seeing, here's what they're presenting with, does this meet criteria? And I'll walk through it with them and say, like I talked to the colleague the other day and she ran me through it. I'm like, yeah, he's not an addict, you're fine. And I just said, like, here's some things to look out for, here's some things to work on this couple with. But he's not an addict. Please treat them. You're totally fine. You've got the relationship. It's good. And then I've had other colleagues that were doing treatment, and I was like, yeah, you should probably refer them to a specialist, because it's just a different skill set.
Yeah. I'm so glad that you shared that you do consultation, because I was ready to ask you that.
Yeah.
You're in my mind. Yeah, because I think we can, we see a lot of issues with couples that come up, and it can be so important to sometimes be able to just consult with someone who knows their stuff and has experience, seeing a broad range of issues and experiences and helping them, because sometimes we just need to process through or bounce some ideas off someone and think it through, out loud. Yeah.
Totally.
Yeah. So that's great. All right. So anything else that you want us to know about your upcoming presentation?
Oh, goodness.
Exciting.
Yeah. Ask me questions. I want to keep it, like, I'm really open, and I welcome questions. I know that it's kind of a controversial, and it's not totally new, but it's newer. So I want people's questions. If you want to bring up a case, ask me about it. It can be a great learning opportunity for everybody when we all bring what we have to the table and dialogue about it. I think one of the things I think is most important for us as therapists is to be honest about our own stuff with ourselves. Especially when we're working with sexuality, man, that brings up our own stuff, because we're all sexual beings. And we live in a culture that is steeped in sexuality and yet sexually avoidant at the same time. And so we as therapists, we need to know our comfort level with this stuff and know who to refer to if we're not. If we're not comfortable with something, that's okay. Like, I'm a licensed marriage and family therapist, right? So I'm a relationship expert, and I can work, technically I can work from, like, birth to death, right? Like, I've done all the developmental psych stuff, right? However, I'm not good with kids. I don't enjoy working with kids. Like, I have a kid, but I don't like working with kids. And so I refer all kids to my registered play therapist friends, because it's just not my wheelhouse. And so because I know that about myself, I send them to the right people. And with, anything that has to do with sexuality, we as therapists need to be honest with ourselves about our comfort level. And if we're not comfortable with it, our clients are going to know that. If we're doing a fake it till you make it with our clients around sexuality, we might do more harm than good. And so I think it's really important for us to be honest about, just to even say, like, I'm just not good around sexual issues. Let me send them to someone who specializes in that area. But I at least like to broach the conversation, and I think that we just need to talk about it more. I think in the same way that we assess for substances, we should be assessing for sexual compulsivity, for internet and social media use, and for eating disorders. I think that we should be assessing for not only substance addiction, but also behavioral addiction, which, gosh, that's a whole nother topic in and of itself, isn't it? But that's what I want people to like. So when we get together, I want people to like bring their questions to the table, and then like let's just talk about it. You know, I'm a pretty informal person, so just let's just all ask questions. And if I don't know the answer, I will tell you, I don't know. Like let's figure out where to go, because if I don't know the answer, I probably know somebody who does.
Awesome. Please join Heather Seguin, LMFT, for her presentation next Friday, November 16th with IE-CAMFT. Her presentation is called It's All a Lie, Helping Couples Heal from Sexual Addiction and Betrayal Trauma. She's going to share her expertise, her knowledge, some of her personal experiences working with couples, particularly those who are healing from an affair, from betrayal, and how to help you assess and learn more about sex addiction, including porn addiction, which is very prevalent nowadays. I hear about it all the time. So thank you guys for listening, and come and see Heather. Okay, see you next Friday.